Prior to my assessment, I will be washing my hands and introducing myself to the patient. Good afternoon, Isabel. My name is RJ. I'm one of the nurse practitioner student here at University of Toronto. I'm here today to perform an assessment of your cardiovascular system. Okay. First of all, starting my assessment, I will be commenting on patient's overall appearance. Her airway is patent. She's breathing with ease. Her color is consistent with her ethnic background. Second of all, I'm gonna look at her eye. Around the eyelid, I'm gonna assess for xanthelasma, which is a yellow discoloration around the eyelids, which would indicate fat deposit. And also in her pupil, around the cornea, I'm looking for any ring-like discoloration, like blue ring around the eye or gray, which would indicate hyperlipidemia. So these are risk factors for cardiovascular disease. Next, I am going to inspect the pericardium for any scarring, okay? And I'm gonna look at any abnormal pulsation in the pericardium. And okay, perfect, and that is not present. Okay, next thing that I'm going to do is I'm going to assess for jugular venous pressure. So with this assessment, I'm gonna have you at this perfect angle here, 45 degree, and you're gonna look at the opposite side, and I'm gonna locate the internal jugular vein, and I'm looking at the sternomastoid, and just around the clavicle here, the internal jugular vein would be located in, can I just tilt your head? In the sternomastoid muscle here, along that line, I'm looking for any pulsations. I'm gonna use a tangential light to just shine over the area, and I don't see any abnormal elevation of the internal jugular vein. At any point, if there was any abnormal distension, I would be going ahead and perform a hepatojugular test, in which this case, I'm gonna perform that. So I'm gonna press over your liver. Just let me know. This could be discomforting, but let me know if you cannot tolerate it. We will stop the test. Okay, so now palpating, and I don't see any abnormal distension of the internal jugular vein. And also, with the measurement, abnormal measure would be greater than 2 centimeters. Okay, the next test that I'm going to perform is cap refill. Okay, perfect. Cap refill is less than 2 seconds, which is a normal finding. Second of all, I am looking to locate the apex. The apex, or the pulse of maximum impulse, is actually located in the 4th or 5th intercostal space. 1, 2, 3, 4, 5, and mid-clavicular line. So I'm okay, and I can feel that. And for any reason I cannot feel it, I can ask you to turn to your left side, and I should be able to feel that. Perfect. Thank you. Now I am going to palpate using the palm of my hand. Okay, I am going to assess for any heaves or trills. Now, heaves are abnormal large beating of the heart, whereas trills are vibration over the pericardium, which would indicate a palpable murmur. So I am going to do that and feel for trills and heaves. Okay. Okay, and that was not evident in this case, which is good. Next, I'm going ahead and I'm going to auscultate using my stethoscope. Using the diaphragm side of my stethoscope, I'm gonna auscultate the aortic, pulmonic, tricuspid, and mitral valve. Now, the location is important, so I'm gonna locate the aortic valve. It is located in the 2nd intercostal space, just to the right of the sternal border. Okay, and the pulmonic valve is located just on the opposite side, on the left hand side of the sternal border. And on the same side of the sternal border, in the third, fourth intercostal space, I'm listening for the tricuspid valve. And on the fourth or fifth intercostal space, mid-clavicular line, is the mitral valve. Okay? Just before I finish off with this assessment, I'm gonna listen using my bell, and I'm gonna have you turn to the side. Okay? Now, this assessment assesses for any mitral regurgitation or stenosis. And I'm also gonna do that, assess your for any aortic regurgitation or stenosis. Okay, now I'm gonna have you sitting up. Okay, and now I'm going to, just lie down for now, and I'm going to assess for, listen to your apex. Okay. Using the Bellamy stethoscope. Okay. Alright. So I didn't hear any murmurs. Okay. The next, to finish off with auscultation, I'm just gonna summarize the heart sound. The S1 and S2 were evident, and S1 indicates closure of mitral and tricuspid valve, while S2 is the closure of the aortic and pulmonic valve. Now, the S3 and S4 gallops weren't heard, which is a normal finding. S3 could be heard in some patients when in younger children or athletes, it could be a normal finding, but S4 is never an actual normal finding in anybody, which would indicate diastolic heart failure. Okay, next assessment that I'm going to do is I'm going to check your extremities. I'm going to look for assess and look for signs of edema. Okay, so I'm doing that in your ankle, in your shin. Okay, and I'm also going to check the coccyx sacrum area. Okay, and I see that there's no edema there. I'm looking at the hair distribution as well for any abnormalities in distribution, which would indicate vascular disease. And also I'm looking for varicose veins while I'm here. Okay, perfect. Okay, the next assessment that I am going to do is to assess for Allen's test. Okay, so now to perform this, I'm going to ask you to open and close your hand, and this would assess the radial and ulnar artery patency. Okay, so keep opening and close. When I say stop, you're gonna close your hand.
Okay.
Okay, stop. I'm occluding your radial and the ulnar artery. Open your hand. Okay, now I'm gonna let go of the radial artery. And as you can see, the return of normal color. So we're gonna do that on the opposite side, on the ulnar artery. So you're gonna do that the same. Open and close your hand. Open and close your hand. Okay, close. Okay, now I'm gonna open your hand. Now I'm gonna let go of the ulnar artery. Okay, perfect. So I can see that it is patent and there's a return to normal color. So that would conclude our assessment, and thank you so much for your time. Do you have any question for me?
No, I don't think so. It seemed very thorough, and I appreciate that.
Thank you.